can say whatever you want to say about me as a Black woman, but I am taking care of my health and I'm responsible for it. That's it.
That's right. That's right. It makes me think of when the first time a doctor recommended that I get a hysterectomy, I was about 33 years old. I have a history of fibroids, and they are big and bad fibroids. I still have them to this day, but they're all up and down there. And I know that like is common for Black women. And so one of the first things that when I walked into the doctor's office, he was like, "You're still young. But if you don't have any children, we could just take your uterus. We could take your uterus. We'll leave. We'll do a partial. You know. Do you feel like, Dr. Angeline, that when other doctors, not Black doctors, non-Black doctors, are dealing with Black women, it is just like a means to an end? They're not going through the gambit and saying, "Well, here are your options." Are they just going directly to that? And why do you think that is?
I think it can go either way, right? I've had some great experiences with those who didn't look like us, and I've had some not so great experiences with that and those that look like us. I remember I went into a doctor's office one time, and when I walked in, I had got hurt on the job, and so they sent me to the doctor. It was a big sign as you walked into his office that said, "You and I will get along very well as long as you remember that I am the doctor and you are the patient." I was like, "Oh God, we're gonna have problems already." I could already see it. And
Mm,
as soon as I got into that office, he talked at me, not to me,
mm,
didn't hear what I had to say. And I had to go because of my job, right? And then referred me back to his sign. And we
mm,
won't talk about what happened after that. But yeah, so I think sometimes they think we don't do our research. I think they think that we are just going to trust them because they are the doctor and this is what the doctor has told us. This is what the doctor says. And I agree with the other ladies, like we have to also do our own research. But I also believe, and this has worked for me, that I don't go by myself. If it's something really big, I take a
mm,
friend or a family member because I'm always thinking, what if they say something that I missed? And that I might not hear. And being in the advocate justice world, to me, having somebody there that will advocate for you, that will advocate on your behalf, I think is another way that will assist us when we go into these spaces. And I think too, when they see maybe a couple people coming with you, that kind of makes them think a little differently, like, oh, it's not just her, right?
mm,
She's bringing someone with her who uh, will listen as well. And so I
mm.
found that that has worked for me because sometimes I don't have to say anything. Who I bring with me will speak up and then they'll say something.
Yeah, I love that. That makes me think of, remember during COVID, and I think this was part of why so many people passed, but your family couldn't come into the doctor's office with you. Like a lot of people went in and they were not fine. Maybe they were sick, but and we didn't know what was happening to people. And before you know, it's like, "Sorry to inform you, your loved one has died," over the phone.